Hi guys, welcome. I just want to show you this advertisement in AIMS Rishikesh. Actually, there is a job vacancy for you. I'm telling you two things. First is the job vacancy part where Rishikesh AIMS is asking for doctors. You can see the advertisement over here. And one more thing I just want to point out is that, see, there is a non-medical candidate for the Department of Biochem, Anatomy, and Pharmacology subject. Do you think this is fair? I'm not degrading them. I'm having really good respect to them. I'm not having any discrimination towards them. But the thing is that there is enough doctors right now in India who having a degree in these non-clinical subjects. I'm from a non-clinical branch. I'm doing post PG in non-clinical. So it's really bad for the non-clinical people. Hope you understand that once you graduate from the non-clinical subject, it's going to be hard to get a job. The private people are going to play with your life. That's the reality. I know that I used to hear a lot of story from the Tamil Nadu, some places that they are working for months and they are not getting salaries. This is the reality of non-clinical people, and that scenario you need to understand. They are hiring the doctors who need to teach the undergraduate students who having a degree of MSc, BSc, and PhD. Like, do you think this is fair? They can apply for many other jobs. They do have many opportunities in their life. They can do like research work. They can work and teach in many colleges and degree colleges, other colleges. But in a central institute like that, if they are taking the clinical doctors job opportunities, then that is not fair. The government is doing utter, what to say, stupidity towards the system. This is not fair actually. What do you think? I'm just asking to the non-clinical PG doctors and the doctors, those who are studying right now. What do you think about this? Do you think this is fair? I don't think so. I'm from a non-clinical branch. Okay, I don't feel it's good. Where is the job actually? There is plenty of doctors are coming out with this non-clinical degree. So they are. You have to understand what their situation is. There is no job for anatomy, this biochem, pharmacology. These people will have to depend on the central or the private institutions only. At that point, see what's happening here. See, there was a time there was non-clinical branches. The graduates in the non-clinical branches was not that too much, not that much, not sufficient. That's true. But right now the situation is changed. If you ask for a non-clinical branch doctors, there's a handful number of doctors will come for the interview. That's the situation. That's the real situation in India right now. The doctors, MBBS, MDs are really saturated right now. That is a reality, the reality part, because every year around 1 lakh doctors is passing out. So there is no such a scarcity of doctors in India right now, both in clinical and non-clinical part. But this is something not acceptable. There should be, the Doctors Association, like Indian Medical Association. There is so much other association there, like Unified Doctors Association, AIMA, and so much of out there. They should raise this issue. At least they let them work in some private medical college or somewhere is alright. But in Central Institute, if they are taking the job opportunities of doctors who completing MBBS and MD degree, then this is totally unfair. Totally unfair. I just want to tell you that this is not fair thing. And trust depend upon you. What's your opinion about that?